Hello, welcome to the March board summary. This was the first meeting since the announcement that has gone out regarding Paul Mears, and we started the meeting with the board acknowledging and thanking Paul for his dedication to YDH over the past 5 years and to the incredible progress that we've made under throughout the organisation under Paul's leadership. We also said goodbye to Julian Gravesbrook, who was one of our non-exec directors, and Julian has come to the end of his period of time with YDH. So Julian will be being replaced in April by a new non-executive director. We started the board meeting with a patient story, as we always do. This month's patient story focused on stroke services, and we were joined by Dr. Khalid Rashid and Caroline Smith, our nurse consultant in stroke, and a patient. And we heard about a really compelling story regarding a complex transfer of a patient to Bristol for a thrombolectomy procedure. It was a real case study of collaboration across the local system. And was incredibly heartwarming, and we also acknowledged, like we did last time, the psychological impact that such incidents can have on individual patients. And out of the board story, there were some really clear learnings, particularly around the importance of early diagnosis and priority transportation in this sort of case. And we're going to be picking up some of the learning from the case study as we go forward. We then moved into an operational update, and two areas that I just want to acknowledge. One was the incredible response of YDH to the challenges of Storm Emma and the severe weather back at the beginning of March. And I think for me this was really encapsulated by the number of nominations that we had for our eye care champions in that month, with some incredible stories of dedication and people going over and above to support YDH and our patients during that period of time. And the board acknowledged that and wanted to thank all the staff that were involved over what has been, what was a really challenging weekend. Operationally, February has continued in the vein of the rest of the winter. Some of the headlines for you: we've seen about a 12% increase in attendances to A&E over this winter compared to last winter. That's converted into about a 3% increase in admissions. But we have seen a reduction of about 2% in the number of people requiring stays overnight, which is a significant change in the previous trend of about a 6% increase. And I think the combination of the work that we've done around the expansion of our ambulatory emergency care service and the impact of the Symphony programme with our local GPs managing people with complex conditions in a different way in the community is now really starting to have an impact. And I think the board acknowledged how tough it's felt for the organisation over that period. But clearly, without these sort of developments, without this kind of innovation, things would have been and could have been even more challenging for us. I think we were pleased also to note that in recent weeks we've managed to recover 6A, and which is now being dedicated back to elective operating. But we do acknowledge the continued high pressure on the organisation. Only today, we've seen in excess of 200 attendances through A&E and AEC again, and we are still under significant pressure, like the rest of the NHS. We talked a little bit about our operational plan for 2018-19, so looking to next year. And as part of this, every NHS organisation is asked to agree something called a control total, which is the financial number that you're going to aim for as an organisation. We've been working across the Somerset system, so in collaboration with Musgrove Park Hospital, Somerset Partnership and the CCG to agree one control total for our 4 organisations. And as a result of that, we haven't signed up to our individual control totals. What we want to do is to work with our system to develop a 3-year financial recovery plan, and work is now underway across the system to develop that to address our financial challenge through the Sustainability and Transformation Partnership, the STP. We also noted that we have a new Chief Information Officer, so Tom Norton, who many of you might know already, will be taking over and has taken over from Jason McLennan, who left us on the 1st of March. From a performance perspective, the organisation's performance remains strong. We're doing really well against our A&E standard, although we did dip below the national standard a little bit in February with performance at 93.8%. But I think we're still very much in the top 5 in the country for that, and other performance around RTT, diagnostic standards, all remains really strong. While I'm here, I'd just like to take the opportunity to mention 2 other things. One is in the previous board meeting, we refreshed our trust strategy. We're going to be launching that into the organisation from tomorrow, and managers will be coming and talking to you about the revised strategy. The revised vision for the organisation is to care for you as if you are one of our family, which I think absolutely encapsulates what we aim to achieve here at YDH. So there'll be more about that over the coming days and weeks. And the second thing I just wanted to acknowledge is that after the board meeting, myself and Tim Scull, the medical director, attended the medical staff health and wellbeing event where they launched something called the HALT campaign, which is really about encouraging staff to take breaks and to value their time, recognising that people who take breaks also improve their productivity, feel better at work, and are more able to cope with some of the challenges that we all experience on a day-to-day basis. And I think many of the learnings there from the HALT campaign, which was developed at Guy's and St Thomas's, particularly for medical staff, are things that actually we should all be looking at and taking note of. So again, we're planning some more communications about the HALT campaign generally for all staff across the organisation. And particularly on that, I'd kind of note 2 things finally. One is that to support staff, we are developing some on-call accommodations for staff to use after they've finished a shift, should they require a rest before they go home. And secondly, we are currently going through some scoping to see whether we can develop a staff room for staff across the organisation to use. So those were the main points of the March board meeting, and I'll see you again in a month.